Hello, and welcome to Zufall Health and Delta Dental's Continuing Dental Education Series. I am Dr. Jade Duncan. I'm the Senior Vice President of Dental Services at Zufall Health, and I'll be moderating today's course. A few housekeeping items. Before we get started, I would like to run through some housekeeping items. All guests join our webinar on mute. We encourage you to ask questions to today's speaker, Dr. Emma Guzman, through the Q&A box. All questions will be held until the end of the presentation. Be sure your Zoom display name is your own name so we can verify your attendance in the webinar. To receive CDE credit, please remember to be present for the entirety of the session and complete the evaluation at the end of the presentation. The link to complete the evaluation will be posted on our CDE page at zufallhealth.org/CDE. The evaluation will remain open for 1 week after the course. Once the survey is closed, CDE certificates will be issued to participants. You will also find the links to register for upcoming courses at zufallhealth.org/CDE. You can register for future courses by visiting that page. We also display our past courses here. After the course ends, you'll find a survey below Dr. Guzman's name on our CDE webpage. Again, this evaluation will be open for 1 week. Your certificate will be sent to you following the end of the webinar in about 2 to 3 weeks. Now, I will share some information about Zufall Health for anyone who is new to our organization. Zufall Health is a federally qualified health center in Northwest and Central New Jersey. We have been serving patients for over 30 years, and we were founded in 1990 by Dr. Bob Zufall and his wife, Catherine, pictured here in front of our dental office in Dover. In 2024, we treated more than 50,000 underserved patients across 7 counties in the state. We want to give a big thank you to our CDE series sponsor, Delta Dental. They have been a longtime partner of Zufall, supporting clinical operations in our very early days to our Zufall Health Delta Dental mobile unit, as well as our Smiles for Our Heroes event that provides dental services to low-income veterans. They have also been supporters of our new clinical space in West Orange that opened last year. The CDE course series is one of a few of our current oral health initiatives. We also have a community dental health coordinator, CDHC program that trains professionals to help patients navigate the dental healthcare system. And our dental assistant training program provides on-the-job training to participants right here at Zufall to help us address critical gaps in the dental workforce. Lastly, and this was just announced, we will be having our Smiles for Our Heroes event on June 21st this year, and you'll get more information about that. How can you get involved? We have a few opportunities for you to support and get involved with Zufall. We always welcome your financial support, of course. You can make a tax-deductible contribution to us through our foundation at zufallhealth.org/donate to support access to healthcare for our underserved patients. And next year, we'll be looking for volunteer opportunities. This year, sorry, June 21st, we'll be looking for volunteer providers once again for our Smile for Our Heroes event. You can always reach out to Afaf now, and she's linked on all of the websites for our CDE, and you'll have her email there if you're interested in participating. And now, for the reason of the evening, Dr. Emma J. Guzman. Emma J. Guzman, DDS, is a distinguished general dentist based in New York, New York. Beyond her clinical work, she's a speaker, mentor, community builder, and advocate for health and wellness. Passionate about service, Dr. Guzman provides dental care to underserved communities in Mexico, the Dominican Republic. She also mentors and guides students pursuing careers in dentistry and STEM fields. Guzman earned her DDS degree from the University of Buffalo School of Dental Medicine and completed her general practice residency at BronxCare in the Bronx, New York. Today's session is titled Total Wellness, Empowering You to Achieve Your Best. If any of you were at our symposium, you heard a little bit from Dr. Guzman, so there was absolutely no way we will start this year without bringing her back in to be the first one you hear from. So at the conclusion of this program, participants will be able to assess health with Dr. Emma's Health Revamp quiz, develop a personalized wellness plan. Attendees will learn how to create and implement a personalized wellness plan tailored to their unique needs and professional demands. This includes setting realistic goals, identifying resources, and tracking progress to ensure sustained well-being. You'll also learn to recognize the impact of wellness and professional performance. Attendees will understand the direct correlation between personal wellness and professional effectiveness. Attendees will also learn how prioritizing their well-being can lead to a better patient outcome and job satisfaction. What a way to start the year. Dr.
Yes.
Guzman, I'll now turn it over to you. Thank you so much.
Thank you. Thank you. Thank you for having me. It was such a pleasure being with you guys. A few months ago, I couldn't help but come back. So I am here with you tonight, and I am super excited to share my presentation with you. So, what I'm going to do now, I'm going to share my screen so we could get started. All right. So, the title of my presentation is Total Wellness, Empowering You to Achieve Your Best. So, what are we going to talk about today? What is our plan of action? So, first, we're going to figure out who is Dr. Emma. Dr. Duncan gave me an amazing intro, but I'm going to talk a little bit about myself. The next thing we're going to talk about is total wellness. What exactly does total wellness mean or holistic wellness means? And the wellness plan just for you. But how do we make it happen? I'm going to talk about these things and I'm going to let you know how can we implement them. Working on your wellness. So we're going to talk about how does wellness affect your performance at work and living joyfully. So we're going to bring it all together to talk about how we could create a life that we all enjoy. So, who is Dr. Emma? Who's this girl? I look fabulous in that picture. I'm still at work. So, this is my day to day. So, who am I? So, one, I am a general dentist. I am practicing in New York. So, I've been in Brooklyn, I've been in Harlem, Long Island. So, I've been in all the places. I'm also a clinical instructor at NYU, the Brooklyn location. I'm a speaker. I've spoken at many conferences. I do podcasts and also I do webinars. I'm a community builder. One of my biggest goals and passions is to continue to bring people together for a higher purpose. So that is me being a community builder. I'm a mentor. I mentor students for the diversity in dentistry mentorships. I mentor students from my undergraduate degree, and I mentor students from my graduate program. I'm a wellness advocate. So I started speaking about wellness because of my wellness journey. And I've had such great success and such amazingness brought to my life that I just want to share it with the masses. Joy seeker. One of the things in life that we need is joy, whether that's in work, in our daily lives, when we're on vacation. Joy is something that we absolutely need. And it is my passion to help others bring joy to their lives. So, what is my wellness journey? So, I'm going to take you through my journey and let you know how we got here. So, the first step, I was a dental student. Okay. So I've always been involved in athletics. I was a cheerleader, I was in dance, and I always stayed relatively healthy. But what happened in dental school? We're wearing scrubs the majority of the time. At my lab station, I'm having gummy bears, monster energy drinks. So I'm taking a lot of calories, wearing scrubs. So when they get kind of tight, I just got a new pair of scrubs. Never really thought about how this was impacting my health. I still was going to the gym, while I was in dental school, but of course, not at the same intensity. But it was the way that I was eating that severely impacted me. And when I was in dental school, this was actually my last day at clinic. This picture was taken. I look a little tired there. When I was in dental school, I gained 30 pounds. So, this is what kind of started my uptick of gaining weight. Then, the next thing, I was a tired resident. So if you guys remember residency, I did a GPR. So we were on call. So we're getting calls 12 o'clock in the morning, 2 o'clock in the morning, 4 o'clock in the morning, and we still had to be in clinic at 8 a.m. So even though I was trying to implement, my wellness strategy, then I really was not paying attention to how I ate. I always consistently worked out, but I did not pay attention to how I ate. I was severely stressed. I'm a resident, right? I'm in a hospital. I'm getting called in the middle of the night. I have anxiety about, certain ringers that I can't even have on my phone because it reminds me of the beeper. So it was very stressful. So definitely not taking care of my mental health or taking care of my nutrition. And then when we go from there, we're a hungry new dentist. So what does that mean? I was working 6 days a week. When I first got out of residency, I was working a lot because one, if someone asked me if I wanted to pick up an extra shift, I always said yes. And two, I started thinking about paying these loans back. And also, once you start making money after years of not having any money, it's kind of nice. So I was working a lot. Once again, who's thinking about my mental health? Who's thinking about my nutrition? I eat relatively okay, but I'm not paying attention to how much I'm intaking during the day. I'm not paying attention to how I eat, when I eat, but I'm still going to the gym. So what's going on here? Now, this was me in 2022. So at this point, I wasn't working as much anymore. So I did lessen my workload. So at this point, I was working 5 days a week, 1 week, and 4 days a week the next week. But I was no longer satisfied with work. I was completely disconnected. I felt like I didn't like dentistry. Like, look at the fake smile that I put on there, and it was my birthday celebration, and I had this fake smile on. And I wasn't okay. And I knew that I needed a change. So, my initial change was I have to leave my job because my job is the reason that I don't like dentistry. But I actually started to go to therapy and to do other things to try to figure out, okay, what is really going on with me? And I'll tell you how how that went. I'm going to explain my journey throughout the presentation. So now this was me a few months ago. I look refreshed, I look renewed, I am 50 pounds smaller, you know. So it was quite the journey, but it's way more than physical health, which is what in the first 4 chapters of my life that I described here, I always just focus solely on my physical health. So we have to start focusing on ourselves, right? I feel like as healthcare professionals, people who are part of the healthcare team, we spend so much time taking care of other people. We ignore ourselves. We don't get checkups. I don't know when was the last time I got a cleaning. I didn't say that out loud. We typically don't take care of ourselves. So we work through the pain. So one of the things that was super impactful for me was the fact that I started getting very severe back spasms. And this was if I'm working 5, 6 days a week, constantly leaned over, ergonomics, we're not really paying attention to that when we're just like, we have to get things done. We have to move fast. We have to move quickly. So the first thing that I had to do was address pain. I didn't address anything else yet. I was addressing my pain. So I started going to a chiropractor. I had to go to a chiropractor twice a week. I started making sure that I was weight training 3 times a week, and that was my chiropractor's recommendation. But I say one of the things that really was impactful that catapulted my weight loss journey is I had surgery. So if you could see in this picture here, I was always relatively fit, but I was a bit wider. And my upper area is a bit busty. So I felt that getting a breast reduction was going to reduce my pain, and it absolutely did. So that was the first step I took in my wellness journey, and it really catapulted the rest of my wellness journey. So I had to go through different different types of evaluations, proving that I have back pain due to the size of my chest. And this is a lot of things that people may not think about, especially, women in our field that are large chest size, the weight that we're putting on our back, in addition to just being hunched over, right? So I had a lot of back pain from it. And just after the surgery, I couldn't work for about 6 weeks. I couldn't work out for almost 2 months. So I was very stressed out about that. But when I went back to work, I immediately didn't have back pain. I felt so much better. So I was like, okay, let's start focusing on ourselves. Let's start addressing pain before we address anything else. So the next thing that I did was focusing on me inside and out. So the pain was addressed, right? My initial pain was my back pain. Now I have other aches that was caused by my weight gain, but that was the real focus. So now that I'm starting to think about what am I going to do for myself, these are the things that I had to do. I went to a nutritionist to figure out, okay, if I'm eating well enough, why am I not losing any weight? I had to go to an endocrinologist to make sure that everything is good with my thyroid, everything is good with my metabolism, because something has to be the reason why I keep gaining weight and I'm not losing, even though I'm consistent at the gym. I went to a weight loss specialist. They checked that I got EKGs taken, they did blood work so we could figure out, okay, what is going on with Emma on the inside so we could figure out how to improve her life on the outside. But I would say one of the most impactful things was when I started going to therapy. When I started going to therapy and we started addressing my sleep, we started addressing stress, we started addressing my lack of boundaries at work, that's when I really started to see change. So I focused on all these things, and there was a 40-pound weight loss in 6 months. So that was me. I started seeing all those providers in the summer of 2023, and this was December of 2023. So now we want to talk about we had this weight loss. We are seeing so many changes in our life, but how do we maintain it? The way that I maintain it is by having a personalized wellness plan that's specifically for me. I don't recommend that people eat a certain way. I don't recommend that you seek a certain type of counsel. What I do is I say, this is what I did. Figure out your body, learn your body, and do what works for you. So, I have my own personalized wellness plan. And what we're going to discuss tonight is how you can make your own wellness plan. And my audience, all of you are my accountability partner. I started posting on Instagram and on Facebook when I was working out, and I would ask my audience, hey, did you work out today? And people really loved it. And when I tell you, if there a day passed and I didn't work out, people are checking me. They're like, hey, I worked out today and you did not put up your poll, right? So people really started enjoying watching my journey. I started running, and I have all these people who run who are watching my videos, and they're just like, hey, you need to improve your breathing here. You should do this. So my audience really became my accountability partners. And it's super important when you're undergoing a wellness transformation. And what I mean by that, that is not only weight loss. A wellness transformation, it could be weight loss, it could be weight gain, it could be mental health clarity. So there's very much different things that could mean a wellness plan, but we want to see what are your needs? What exactly do you need to do and how we can make that work for you? So, what exactly is total wellness? So there's multiple definitions that you could find, but this is the definition that really resonates with me. Wellness is the complete integration of the body, mind, and spirit, the understanding that everything we do, think, eat, and believe affects our well-being. So when we talk about speaking things into existence, not speaking negativity into your life, saying, I'm going to do this, not saying that you can't do certain things, all of this affects your overall well-being. So let's talk about physical wellness first. So what are the three things that we need to think about when it comes to physical wellness? Getting our body moving, what are we eating, and sleep. Those are the three things that you want to focus on and think about. Okay, if my struggles is the physical, these are the three things we need to think about. So 24.2% of adults aged 18 or older do meet the physical activity guideline for aerobic and muscle strengthening. So that's weight training. Okay. So these are numbers that are given by the World Health Organization, and they're surveys that are giving out to people. So, of course, it's self reporting. Okay. But even with a self report, only 24% of adults in the United States meet the standard of what we need to be doing daily for physical activity. And that physical activity includes walking, running, yoga, Pilates, weight training, anything like that, any type of movement. Only 24.2% of the whole population meets that. And what does that do for the healthcare system? What does that do for the public health system? It costs more money because now we're worrying about how to take care of illnesses instead of prevention. Is estimated to cost $27 billion per year to do care that's needed for patients with diabetes, cardiovascular disease, hypertension, certain cancers, just because we're immobile. And society had made being immobile very easy, right? We could order things from our phone, get it delivered to our house. Our groceries, our toiletries, everything could be sent to the house that we don't have a reason to leave, especially when it comes to remote work as well. It caused a decrease in the number of physical activity. And we already know that physical activity improves our mental health. It improves our cognitive health, and it improves our sleep and body fat percentage. But even knowing that, people still don't move. The next thing that we want to focus on is our mental wellness. So that's mindfulness, stress management, and continuing learning. So, stress management is a huge factor, is a huge key in this, just because we live in the United States, we're working, we're adults, and sometimes adulting could be very, very stressful. And we don't have certain coping mechanisms to handle that stress. So we want to make sure that we know how to handle our stress. And continuous learning is extremely important when it comes to job satisfaction. A lot of the times people don't feel like they're what they're doing on a daily basis is worthy. People get bored of their jobs. People feel like they're not appreciated at their jobs. So one of the biggest things is making sure that we continue to learn so that we can continue progressing and enjoying what we do on a daily basis. Our emotional wellness. How do we handle this? How do we build more resilience, right? Resilience is your capacity to deal with the things of life, right? How tough are you, right? Are we seeking support? There's not that much of a stigma now. It's 2025. Most people have therapists. Are you one of those people who are still not seeking help? Why is that? Right? What is that friction that's created? And how can we combat that? And also self compassion, self love, and not beating ourselves up. We tend to do that. We are perfectionists, especially if we're in the healthcare industry. We want to make sure that everything is prim, proper, and the way it needs to be. And that puts a lot of pressure in ourselves that's 100% self imposed, and no one else is putting that pressure on ourselves. So, how do we combat that? Our spiritual wellness, it's about a greater purpose, is about meaning. It's knowing that there's something greater beyond ourselves. And how do we address that? And let me be very clear, spirituality and being religious is two different things. So, what are the stats when it comes to physical activity and health professionals? So, they did similar guidelines in Europe. These studies were not done in the United States, but when they were done in Europe, same thing, it was self-reported. 48% of healthcare professionals met the guidelines. So that's great because that's better than the majority of the population. But what we did see in that study that was mostly workers that either worked in hospitals and they meet the physical activity because they have to move around in the hospital, go from place to place, go from unit to unit. And also, we saw that in professionals that specifically dealt with physical movement. So we saw that mostly with physical therapists. So I just mentioned that as well, that it was nurses and physical therapists that in their work, they met that physical activity. But we want to talk about what are people doing outside of work? And especially when it comes to dentistry, we do not fall in that category. Am I going up and down? Am I moving a lot throughout the day? Yes, but I'm going from one chair, I stand up, I walk to the next chair, right? When I'm at work, I have to be very conscious about getting my steps. I'm taking the steps up and down. I'm doing these things to get movement because I know on a day to day, I could be in a chair all day, right? If a student doesn't need me, I'm sitting in my office. So we do not fall in the category that we're getting our physical activity done at work. So we need to be intentional about getting that physical activity outside of work. So, how does stress impact us? It impacts our physical activity and our wellness overall because if we're stressed out, we're tired, the last thing I want to do is leave here and go to the gym. I want to go to the bar and get a drink. So, stress impacts us. And then we know that stress raises our cortisol, right? So there's good cortisol and then there's bad cortisol, right? When stress is raising your cortisol, that impacts you negatively versus there's certain raises in your cortisol when you're working out and you're doing all these things, right? So when you weight train, when you work out more, your body learns how to manage stress better. So you're not as affected as the daily stressors in life. So it's super important to maintain your wellness and it helps you combat stress. But also, it's important to minimize your stress for your overall well being. And what are certain barriers for healthcare professionals when it comes to our physical wellness? Long working hours, right? The shifts that we're at work. If we work during the day or, we have overnight shifts, we're sleeping during the day, so we can't go to the gym. If we work long hours, we're tired. So the last thing you want to do is go to the gym. You want to go home and rest, right? There's lack of time. A lot of us work outside of work. A lot of us have families. A lot of us just have different things to do that makes regular physical activity challenging. So you have to be extremely intentional. This is not something that is going to come easy, but is absolutely possible when you implement the proper steps. And one thing that you want to take advantage of, you want to see what type of programs does your job have? Does it have support programs for mental health? Do you get certain discounts from your job for fitness facilities? I know working at an educational institution, we get these certain services and we get 20% off here, 10% off here just with your ID, right? So you want to make sure that you do research and you see if your institution offers any wellness programs. And how does our wellness affect patient outcomes? So it was stated in a study done by the World Health Organization as well that healthcare providers' own lifestyle habits influences their attitudes toward counseling others. So what did that mean? Do we feel equipped to even talk to our patients about wellness if we are not walking that walk? So if we're not walking that walk, how are we able to talk that talk? So it was shown in the study that patients who receive a physical activity prescription from their doctor are more likely to do it versus our friend or someone else telling us, hey, let's go to the gym. If our doctor is telling us, you need to do this to improve your lifestyle, you need to improve your nutrition, and really give us a physical activity prescription, patients were seen to more likely move forward with that. But the issue is that the study also showed that healthcare professionals don't. We don't prescribe wellness, right? I know in my field, a lot of the times I'm not talking about wellness with my patients unless for whatever reason in their oral habits, they're asking me for a mouth guard. I see they came with gym clothes or something that I'm talking about it. But even as physicians, because this study was specifically done with physicians, it's saying that they are not asking their patients about it. And a lot of the time is because they feel rushed, is very busy, but doctors also felt that they weren't equipped to speak to their patients about this. So, what is all this talk about burnout? Right? How are we going to be equipped to speak to our patients about their wellness if we are not doing well? So, there are certain characteristics of burnout. And if you are burnt out, that is the first thing that has to be addressed before you implement anything else that I tell you. Okay? So what are the signs and symptoms? Okay? So it's emotional exhaustion. It's feeling completely drained, right? It's depersonalization. You feel detached from your work, you feel detached from patients. You start to notice that you're not as empathetic, you don't care as much, you don't feel accomplished when you have certain wins at work. You're not satisfied. Even if everyone could be championing you, you don't feel good about it. You feel disconnected from your job. And you just don't feel like you're being effective, even though you're doing the same things as before. So there was a study done in 2022, and this is by the National Health Organization, and they said that 46% of healthcare workers in 2022 felt like they were burnt out. And of course, a lot of this has been post pandemic. The stressors, right? When it comes to not having enough help, right? The healthcare industry completely changed after the COVID-19 pandemic. So these numbers are not surprising. And it said that 44% of healthcare workers intend to look for a new job. We already heard about this, right? The great resignation. Everyone is resigning from their jobs, but everyone is actually starting to focus on their selves more, focus on their wellness more. And I also think that that's a contribution to that number. And I'm actually not mad at that, right? We need to start looking for places where we're going to be happy and where we get that work satisfaction. But we need to handle what is the key, right? What is the cause of our burnout so we could know how to address that? And it may be the job, it may be something else, right? That's making me believe, because that's the way I felt. I believed I didn't like dentistry anymore. Oh, I must not like clinical dentistry anymore. I have to do something else. Once I remove myself from that situation and put myself in another situation, oh, all of a sudden I like clinical dentistry again, right? It may have just been the environment. So that's something that you have to think about if you're ever feeling burnt out. So, what are things to manage that? Okay. And what the heck is self care? So, I was one of the people that when my therapist spoke to me about self care and she asked me what I did for self care, I was just like, what's self care? And she's like, okay, we'll talk about that in the next session. And I literally had to Google it because I'm just like, I don't know what I do. Like I just exist in the world, right? And if you think about what is categorized as self-care practices, it's taking care of your wellness. It's eating well, it's moving, it's sleeping, it's thinking about your mindfulness, your spirituality, it's taking time off. Okay. I don't know if everyone heard me. It's taking time off, right? It's giving you days to rest. and reset. And it's connecting with others. Taking time off and connecting with others are two key things that I want to point out. Because especially as healthcare professionals, a lot of the times it's hard for us to disconnect from work. It's hard for us to take days off. I was a resident who never took a day off. Didn't get that time back from the hospital, right? I'm the person who never calls out. I'm sick. I'm still there. I'm like, I'm going to double mask. And I was always working. What's a mental health day? What is that? When I would hear that people even took mental health days, I was like, what is that? Right. But once I started focusing on myself, I'm just like, hey, these are my days off. I'm taking them, figure it out. It's super important to spend time with the people you love and the people who love you, because the majority of our time, unfortunately, is spent at work. So, yes, we have to enjoy those people as well, but it's important to make a point to spend time with your family and friends. So, how do we manage it? We have to set boundaries at work, right? We have to manage our workload. We have to actually stop working at a certain time. That was a boundary that I absolutely set when I leave the office. Unless it's a patient emergency, a real emergency, it's a prescription that needs to be sent, do not call Dr. Guzman. I will not answer. I will look at the email tomorrow. I will look at the message tomorrow. Once I leave, right? We have to focus on the essentials. We have to learn how to say no. We have to learn how to delegate. If you don't have certain autonomy in things, you need to speak to your supervisor, reach out for outside assistance, employee assistance programs, right? If you're unable to minimize your workload, maybe you could seek help on just how to manage it. Can we get more members of the team on this? Can I get a longer time to do it? Because killing yourself is not the way to go. It's not the way to go, killing yourself trying to do something. Okay. And mental health is key, right? We have to find meaning in our work. It's very difficult to be at work every day, the majority of the day, and we don't have any feeling towards it. We don't have any meaning towards it. Absolutely, it pays the bills. It does what we need to do. But how long does that last when we have to deal with the stressors of work? There's always going to be stressors of work. I'm talking about, okay, how do we remove the stressors that are unnecessary? How do we build resilience for the stressors that we have to deal with, right? How do we cope with that? And a lot of the times, coping with it is delegating. It's saying, I will handle it tomorrow, not I'm going to do it when I get home, right? And speaking to our supervisors, our managers, and our colleagues and letting them know, hey, I'm overwhelmed. This is a lot for me. Because that's a part of building a life that you want, building a life of enjoyment, not feeling like you have to take work home, not feeling that you can't speak to the people that you work with. So, how can employers help? They have to model and support taking time off. So, we don't want the boss that's always in the office too. We want to see that they're human as well, right? We have to include everyone in decision making, right? When it's needed. We want someone to regulate well-being, right? To support that, to make sure and see in our workplaces like, hey, I've seen you've been working a lot. I've seen you've been staying late nights. Are you doing okay? And we have to train our teams to support each other. We have to train the supervisors to be able to speak to their team and say, hey, you need a break. Hey, I see you have all these vacation days collected. How are you going to take care of that? Right. But one of the biggest thing is valuing your team and making sure you have adequate staffing. A lot of the complaints that I see in multiple places is the fact that you don't have adequate staffing. Now, a lot of this I do feel was impacted with the pandemic as well, where a lot of people wanted to do remote work. Most jobs in healthcare are not remote. We have to go into work. So our field was shortened. So now we still have the same load, but with less people. So we need to figure out how do we manage that load to make ourselves more efficient and less stressed out, because people quitting, people walking out on us, that's not efficient as well. So how do we tie this all together, and how do we integrate wellness into our daily routine? I know this is what we really want to hear about. So we want to develop a personalized wellness plan. So the first thing that you want to set up, you want to set up a baseline. You want to know where you're at. A lot of the times we don't know. Like if you ask me, how do you feel your wellness is? How would you rate yourself, right? From 1 to 10. You really don't know where you are. So you guys should have the handout. That's the revamp quiz. And that's not something that you need to do now, but it's something that I do want you to take a look at and answer the questions honestly. So there's a series of questions that's about your wellness. So that's about work, your mental health, your physical health, your emotional health. Go through the quiz, and based off what your score is, after you answer the 15 questions, based off what your score is, you really know if you need to start to change your habits. So if you score from 0 to 20, you're doing all right. You know, just make sure you keep up with what you're doing and learn more things that you can implement. If you have a moderate need, so that's scoring from 21 to 40, I would definitely consider making changes to your daily habits. And if you have a high need, which is a score from 41 and up, you have to start prioritizing your mental and physical health. As we age, it only gets harder to prioritize these things. So we want to make sure that we get it done. So, where do you start? You establish a baseline. So, you do the quiz, you're in the moderate or you're in the high. I'm talking to you. Okay. And even if you're in the lower need, it's great to get all these things done because you want to know about your body. So, you want to do physical exams, you want to assess your needs, you want to assess your professional demands. And if that's too taxing, how do we minimize those demands? And you want to figure out your supportive resources because we don't want to do this by ourselves. So, what type of exams you should get? You need to get physical exams, and that shows your weight, height, and different blood work. So, now when it comes to the BMIs, questionable, okay, because it's typically not made for the majority of the population. It's made for a certain type of phenotype, but your doctor is most likely going to take it, and it's a decent baseline. But I really don't go off of it. It would be the height, weight, and any other medical risk factors that you need to take care of before you start doing physical activity. Okay. When you get your blood test, you want to know your electrolyte levels, you want to know your kidney function, your liver function, and your iron levels. If you're always overly tired, that may be something that's going on with your iron. And you also want to know all the different vitamins. You want to check that as well so you can see what you need to take. Multivitamins are great, but if you specifically have low D2, you specifically have low B13, you want to take those specific vitamins, okay? You want to check your cholesterol and triglycerides because that's going to help you make your nutritional plan. You want to check your blood sugar, your thyroid function. An EKG is good because if we're telling you, okay, start doing HIIT workouts, you want to know that your heart is okay. And you want to do metabolism testing so you could remove the friction of making the excuse that our metabolism is not okay. Most of the time, our metabolism is fine. It's just that we're not doing the work, okay? Unless you really have a metabolic condition. Because that was the excuse I made. I said that, oh, it's my metabolism. It's my metabolism. That's why I'm not losing weight. Okay. So we want to list your short term goals and your long term goals. And that's in any type of plan, right? So you're going to say, okay, I want to start walking 30 minutes a day for the next 3 months. That's your short term goal. Our long term goal is I want to run a marathon. Okay. Short term goal, I want to start journaling once a week. A long term goal, I want to be great at meditation, right? So there's certain things that you want to really write out and list out what your goals are when it comes to each facet of your wellness, right? Physical health. You want to establish an actual routine. You don't want it to be scattered. You don't want it to just be, okay, I think I'm going to go to the gym. No, no. Monday, I'm going to do upper body. This day, I'm going to do lower body. This day, I'm going to do core. Actually establish an exercise routine, your nutrition plan. That's why it's important to get all that blood work done because then it's able to guide you in how you need to eat and foods that you need to avoid. Your sleep schedule. Sleep affects all of this. If you're tired, you're not going to function properly. You're not going to work properly during the day. You're definitely not going to want to go to the gym. You're going to be too tired to work out. And your body is not going to be able to recover properly if you're not sleeping better. You're going to be irritable. You're going to be upset. And it's just not a good thing in terms of how you cope and manage with stress. If you're constantly tired, you're not going to be able to cope with stress. So it's super important to get a proper sleep schedule. To put your phone on do not disturb by 9:30 if you want to go to bed at 10 o'clock. Remove TVs and electronics from the bedroom, right? There's certain things that you can implement to get a proper sleep schedule. And all of that connects with our mental health, with proper stress management, and seeking help. Therapy doesn't mean that something is going on with you. Everyone needs therapy. Everyone has trauma from their childhood. And it's just talking things out from someone who doesn't know you and could help you manage. The same way we're professionals, mental health providers are professionals as well, and they know how to catch things and see things that we don't see in our daily life. So, what's also included that people don't really talk about is your social well being. Make sure that you have good work life balance, that you're social, you're hanging out with your friends. Professional development. What are your short and long term goals when it comes to your work? So, those are the things that you can look at. Have a post it at your workstation that says, this is what I want to do, and this is what I'm aiming for. This is why I'm here. This is a step to get me to the next place. And of course, self care practices. All of these are a part of your personalized wellness plan. So, how do we implement them? Remove the friction. So, what do I mean by friction? It's all the excuses that you give yourself. Write down what are the excuses that you give yourself that you're not starting to work on your wellness and remove the friction from that. Okay, write it all down and figure out the truths in those statements. My friction was I have a slow metabolism ever since I aged. That's why I can't work. I can't work out. I'm tired. Even though I'm doing it, I'm not losing any weight. I went and got a metabolism test. The doctor told me it was fine. So that was no longer an excuse. And I'm like, oh, wow. Okay. I guess it's me. Right. And I started making, real changes because I removed all the excuses I was giving myself. But my biggest thing, and it's one of my mantras, is start small, start now. Don't wait till Monday. Don't wait till February. Oh, the month just started. I'll start in February. Start now, right? Start small and start now. Make small changes. Changes doesn't have to be removing anything from your life. Changes could just be adding something to your life, doing something that you're not doing yet. So, what else do we need to do? We need to set realistic goals. We need to set goals that are actually achievable, right? It is not realistic to say, if I'm going to say my birthday is next month, Pisces season, I want to lose 20 pounds by my birthday. That is not a realistic or achievable goal. So now my birthday comes, I don't lose 20 pounds, and I'm disappointed. You're setting yourself up for failure. So set realistic goals, set achievable goals. Okay. Next thing you want to do is you want to continually do check-ins. So you want to do weekly check-ins, you want to do monthly check-ins, with whoever you choose as your accountability partner. And I am an advocate of having accountability partner. Other friends that are with you on this journey, even if they're not working out with you, right? It would be, hey, I want you to track that I'm working out. I want you to help track with me that I'm going to the therapist. I want you to help track with me that I'm journaling. Have someone there for you. And if you don't have someone that you could do that with, you could get a wellness coach and adjust your plans when needed. It is okay to pivot. Okay. So well being encompasses the physical, emotional, and mental energy that's needed in the workforce, and it increases your capacity for performance, right? When people perform better when they feel better. How are you going to work well if you're sick, you're tired, you're anxious? It's not possible. Wellness is good for business. So it's good for anyone who's a supervisor here, a manager, to implement those practices in your team. And as a team member, you feeling better makes your day better. I know I was a much better provider when I started feeling better. I was more empathetic for my patients when I was not tired. According to Forbes, it said that when people are exhausted physically, emotionally, and mentally, they're naturally more defensive. They're not able to focus on the things that matter. And they can't connect with their colleagues because they just, quite frankly, don't have the bandwidth to. We want to be energy inspiring. When we communicate better at work, our work performance increases by 53%. When we trust each other, when we have boundaries, we are able to work better. And productive people are not productive by accident, okay? They recognize the connection between their well being, their energy, and high performance. It's all connected. If you don't feel good, you are not going to perform well. So, all of these things that I'm talking about, I truly want you to write it out. Define, the vision for your life. Okay. Take consistent action, prioritize self care, build meaningful connections like we are doing now, remove the friction. Truly and honestly, remove the friction. Stop making excuses. Start small, start now. Even if you say, I'm going to walk down the stairs right now instead of taking the elevator. Now, if you're on the 30th floor or something, I don't recommend that, but start small, start now. Add more veggies to your meal, buy a journal, plan out your day so you're not scattered. Wake up 30 minutes earlier so you're not rushing out the house. These are small things that we could do to improve our wellness. Start small, start now. That is my biggest recommendation. And thank you guys for spending your amazing evening with me. I truly do appreciate it. And if you want to work on a personalized wellness plan, I could work on that with you and we could work on implementing and going through that. So please connect with me. I have my email shared here and also my Instagram. I post my workouts, I post the way I eat, and I really connect with my audience there. So connect with me. And do we have any questions?
Thank you so much, Dr. Guzman. You had a rough day today and you were able to pivot and you want to share maybe 30 seconds about what happened right before you were supposed to join us today.
Okay, guys. So I'm rushing home. I'm rushing home to get to my house so I can do my lighting, do my makeup, look good for you guys. And when I was on the train track, I saw someone fall in between the middle of the train and the track and get dragged across the platform. And I was the healthcare professional that was in the area. I saw it happen. So, immediately I went to her, to see if she was okay, to tell her not to move because people started going. They were trying to pull her from under the train. And I'm like, look, don't move, right? So I was there with her. I was waiting, I waited until EMS came. I spoke to her husband. It was a lot. So I was like, I called Jade, I called Dr. Duncan and I was like, I'm not gonna make it home. I'm gonna try to find somewhere to go, so I could I could be here for you guys. And I just went back to work. So that's why I'm still here. I was a bit shaken. It was a lot, to witness that and to have to be a part of it. So if you guys see me on the internet, that's why. But yeah, that's what happened right before I came here. But that's one of the things. Stress management, being able to pivot. Taking care of yourself allows you to be flexible. And the reason why I could truly say it is because I lived it. I know how I was living on a day to day basis when I wasn't taking care of how I eat, when I wasn't sleeping, when I wasn't working out. Right.
Yeah.
So I feel the effects of how my body just works differently now.
Mhm.
You're more of an effective machine when you take care of yourself.
Absolutely. Someone left a great comment. I do have some questions. We have about 4 minutes. Someone left a great comment saying, besides a personal wellness plan, having a supportive team is a must because if a team member is giving you a hard time, that is also not helpful and quite stressful. And I always tell my team, we're all human, right? And it's okay to have a bad day, but like
Yes,
my big sister Tabitha Brown says, you can have a bad day, but you bet not make anybody else's own bad, right? Don't impact nobody else's. And
absolutely.
and one thing that I learned about culture, especially organizational culture, is really how each person's behavior impacts somebody else's, right? So each of us, we do have a role to play in how our day-to-day lives are, and if we are creating the emotional tax in the clinic, and sometimes it's better to kind of reduce those people who are the ones that are causing that friction in a space.
Absolutely.
And you will know that by when they're on PTO, how peaceful it feels. Then you know who's the problem. Let's be real, right? And sometimes
Right.
you're right. Sometimes you do have to be, especially as leaders, you do have to be careful as to who you hire and how each person impacts how other people work. So that is important.
Absolutely.
So we have a lot of questions. But I'll probably just take a little bit because I see people asking for your email, and I'm going to have a Afaf type your email in there, or you could type your email in the chat so
Yes,
people can reach out to you and get direct care.
absolutely.
Um, so you talked about the strategies and overcoming the barriers and just the realistic things that we have to do as healthcare providers. Sometimes we just don't have the time, right? Sometimes we're just
Yeah,
overwhelmed or we're so tired, and we have to pay the bills. We have to, we have overhead to keep up, but we have a staff salaries to pay, so we got to make sure that we have in the production. And I think sometimes we just get so burnt out that we aren't able to enjoy life. And then when we aren't able to enjoy life, we end up working longer. As in,
absolutely.
into our 80s, people are still trying to find jobs to do, because no one has really set up their life to live. What
Mhm.
is your take on that? And what are the little things in between that we can do to help make us make better decisions about how we manage stress and how much stress we take on? And, yeah, what is your thoughts on that?
Setting boundaries. And setting boundaries is hard. It's like, I know. I'm like, I am such a yes girl. Like, I would say yes to like everything.
Hmm.
I'm such a yes girl. But you
Hmm.
have to set boundaries. You have to put yourself first.
Hmm.
As healthcare professionals, we don't. We don't
Yeah,
put ourselves first.
yeah.
You have to put yourself first. You have to set boundaries. And still my mantra, start, small, start now.
Hmm.
Okay? Literally, when I say I walk to do my errands, right? Okay, this is 2 miles away, I'm gonna walk instead of taking the bus, instead of taking the car, instead of, flying, whatever we need to do, I walk. I have to go up and down the stairs in the clinic, and I see people taking the elevator,
That's wonderful.
Start
Yeah.
small, start now. You could do it. Adding things to your life. When it comes to nutrition, adding things to your diet, reversing, removing. I eat
Hmm.
cookies, I eat muffins, I eat candy, but
But
I
balance.
also eat a lot of vegetables, right?
Yeah.
It's
So
all
we
about
are
balance and moderation.
Thank you. So we are at the end of our session today.
Yes.
Obviously we can go on and on, but please
Yes.
remember to save the date for our next course presented by Dr. Parul Duamaka, When a Dentist Dies of Oral Cancer, the Need for Earlier Diagnosis. I listened to her presentation at the
Wow.
ADA
Yeah.
SmileCon conference. It is a must. You need to be there, and that's going to be on February 26th, and registration will be open either later this week or next week. So please, we encourage you to visit us at zufallhealth.org/CDE so you can make sure that you are keeping up with our future courses. Again, thank you so much, Dr. Guzman. Again, you must take the survey to get credit for tonight, and the survey is in the link, and we'll also um, email it out as well as her quiz and handout to all of you guys. Thank you guys for staying on with us. We really appreciate it, and I hope you learned something to start your year off powerfully. Have a good night.
Good
Bye bye.
night.